Cerebral palsy, myths and facts. Cerebral palsy is a group of disorders that affect a person's ability to move and maintain balance and posture. It may be caused by injury to the developing brain before, during, or after birth. The injury affects the parts of the brain that control movement, coordination, and muscle tone. Cerebral palsy can affect people in different ways. Some people with cerebral palsy may have difficulty walking, speaking, or swallowing, while others may have intellectual disabilities, vision problems, or seizures. Hi, I'm Dr. Beth, and I'm a pediatrician at SickKids. In this video, we will explore some common myths and facts about cerebral palsy. Myth 1. Cerebral palsy is a rare condition. Fact 1. Cerebral palsy is the most frequent cause of physical disability in children in Canada. Cerebral palsy affects 2 to 3 per thousand children in Canada. It is estimated that about 17 million people worldwide have cerebral palsy. Cerebral palsy can affect people of any race, ethnicity, gender, or socioeconomic status. Myth 2. Cerebral palsy is caused by a lack of oxygen during birth. Fact 2. Cerebral palsy can have many different causes, and only a small percentage of cases are related to complications during birth. Cerebral palsy can be caused by a variety of factors that can cause injury to the developing brain, such as infections, genetic disorders, bleeding, stroke, or trauma. While some cases of cerebral palsy may be associated with complications during labor and delivery, such as a prolonged or difficult birth, umbilical cord problems, or low birth weight, these are not the most common causes. Myth 3. Cerebral palsy is the same for everyone. Fact 3. Cerebral palsy is a spectrum of disorders that can affect people in different ways and to different degrees. Cerebral palsy is not a single condition, but a term that describes a range of neurological conditions that affect movement and posture. There are different types of cerebral palsy depending on which parts of the brain are affected. Spastic cerebral palsy. This is the most common type. It is characterized by having stiff or tight muscles that prevent fluid movement. Dyskinetic cerebral palsy. It is characterized by involuntary and uncontrolled movements of the muscles of the hands, arms, feet, and legs. Ataxic cerebral palsy. It is characterized by difficulty with balance and coordination, affecting movement. Mixed cerebral palsy. It is characterized by having symptoms of more than one type of cerebral palsy. A classification system is used to describe how much the condition affects a person's daily activities and independence. Some people with cerebral palsy may only have minor difficulties with walking or fine motor skills, while others might need assistance with eating, dressing, or communicating. Myth 4. Cerebral palsy is a childhood condition that goes away as people grow older. Fact 4. Cerebral palsy is a lifelong condition. Cerebral palsy is caused by injury to the brain that may have occurred before, during, or shortly after birth. This is permanent and does not heal or change over time. However, this does not mean that people with cerebral palsy cannot improve their skills or abilities with the help of treatments and therapies. For example, physical therapy, occupational therapy, speech therapy, medication, surgery, or assistive devices can help people with cerebral palsy improve their functioning, participation, and quality of life. Myth 5. Cerebral palsy affects only the physical abilities of a person. Fact 5. Cerebral palsy can affect not only the physical, but also the cognitive, emotional, and social aspects of a person's life. Cerebral palsy is a complex condition that can have a wide range of impacts on a person's life. While cerebral palsy primarily affects the movement and posture of a person, it can also affect other areas of development and functioning, such as thinking, learning, memory, attention, communication, behavior, and emotions. For example, some people with cerebral palsy may need support with speech, academics, social skills, building self-esteem, or coping with stress. Myth 6. Cerebral palsy is a result of poor parenting or negligence. Fact 6. Cerebral palsy is not caused by anything that parents do or do not do during pregnancy or after birth. Parents of children with cerebral palsy are not responsible for their child's condition. Cerebral palsy is not something that can be prevented or avoided by following certain rules or practices during pregnancy or after birth. Myth 7. Cerebral palsy is a terminal condition that shortens a person's lifespan. Fact 7. Cerebral palsy is not a fatal condition and does not affect a person's life expectancy. Cerebral palsy is not a life-threatening condition, and it does not directly cause death. People with cerebral palsy can live as long as anyone else, and their lifespan is not determined by their condition. However, some people with cerebral palsy may have other health problems or complications that can affect their quality or length of life, such as respiratory infections, seizures, or osteoporosis. Myth 8. Cerebral palsy is a static condition that does not change over time. Fact 8. Cerebral palsy is a dynamic condition that can change over time depending on various factors. Cerebral palsy is not a fixed or stable condition, but a variable and evolving one. Cerebral palsy is not progressive, but people with cerebral palsy can experience changes in their symptoms, abilities, and needs over time, depending on various factors such as their age, growth, environment, treatment, and personal choices. Some people with cerebral palsy may experience improvements in their movement or function with the help of therapies or interventions. Myth 9. Cerebral palsy is a hopeless condition that has no cure or treatment. Fact 9. Cerebral palsy is a hopeful condition that has many options and possibilities for treatment and improvement. While there is no cure for cerebral palsy, there are many treatments and therapies that can help people with cerebral palsy manage their symptoms, improve their function, and enhance their quality of life. For example, medication, surgery, braces, splints, or injections can help reduce spasticity, pain, or stiffness. Physical therapy, occupational therapy, or speech therapy can help improve movement, coordination, balance, or communication. Assistive devices, adaptive equipment, or technology can help increase independence or accessibility. There are many resources and supports available for people with cerebral palsy and their families, such as organizations, groups, programs, or services. Myth 10. Cerebral palsy prevents people from having a normal and fulfilling life. Fact 10. Cerebral palsy does not define or limit a person's potential or happiness. Cerebral palsy is a part of a person's identity, but it is not the whole person. People with cerebral palsy can have a normal and fulfilling life with the same opportunities and challenges as anyone else. They can go to school, get a job, have a family, make friends, travel, have hobbies, and enjoy life. I hope you found this video helpful. Subscribe and visit aboutkidhealth.ca for more. Thanks for watching. Stay healthy, everyone.